Friends, you must have heard of fatty liver. This is now becoming more pertinent and more significant. Many people think that fatty liver happens to everybody and this is normal. But stop here. This is not normal. Normally, the human liver is around 1.2 to 1.5 kg in weight and contains negligible fat. But when the fat content in the cells of the liver becomes more than 5%, it is called fatty liver. How do we pick it up? On ultrasound, when there is fatty liver, it becomes more brighter and whiter. And that's how it is identified as fatty liver on ultrasound. It is reflected in blood in form of high AST and ALT, which are enzymes formed by the liver cells. But when there is fat, there is injury to the liver and these enzymes increase. And that's how the diagnosis of fatty liver is made. Presence of fat is not the mere problem which happens with fatty liver. When there is prolonged duration of fatty liver, it leads to injury of the liver cells. And that is called hepatitis. And after a certain duration of hepatitis, there is fibrosis. Suppose there is a sponge-like structure which becomes hard day by day. And that is called fibrosis. Normal human liver is also soft, but it becomes hardened gradually with fibrosis. And when it becomes gradually hardened, the liver functions fall. Patients start becoming ill. And after a profound fibrosis and diffuse fibrosis, when it happens to all around, the liver starts regenerating because that is a natural capacity of liver, but ultimately fades. And this condition is called cirrhosis. But the good news is that fatty liver can be prevented. Not all patients with fatty liver will have hepatitis, cirrhosis. Around 30% of patients with fatty liver will develop hepatitis. And minority of these hepatitis patients will develop fibrosis, and rather more uncommon is cirrhosis amongst these patients. So only a minority of patients with fatty liver will develop cirrhosis subsequently. Majority will not. And another good news is that it can be prevented and cured. But more important question is, why to have fatty liver at first place? For that, we need to know the causes of fatty liver. The first and foremost, which is most prevalent cause of fatty liver around the world, is being higher body weight and being obese. Normally, the upper limit of body weight is 24.9 kg per meter square. That is BMI. If BMI is more than that, there is cumulative increased risk of development of fatty liver and complications. Let us take an example. Consider this body as a bucket and liver as a small mug hanged in between the bucket. And there is a threshold of water in the bucket. If the water level becomes higher than threshold level, the water starts spilling over in the mug. Similarly, there is a threshold of fat in the body that is 24.9 kg per meter square. And if fat becomes more than this, it starts spilling over in the liver. So for reducing fat in the liver, we have to reduce fat in the body. And that's how reducing fat becomes a modality of treatment for overweight or obesity related fatty liver. Normal balanced diet, restricted calories, regular exercise and disciplined lifestyle are the key features to prevent and cure fatty liver, which is related to body weight. Next is diabetes, particularly when it happens along with obesity. We know diabetes is a lifelong disease, but strict control of sugar and strict control of and regular disciplined treatment of diabetes can keep fatty liver away from you as much as possible. Third is alcohol. Even without being obese or without being diabetic, alcohol can lead to fatty liver in many patients. Fortunately, alcohol-related fatty liver and complications thereof are more rapid and more aggressive than other causes. Fourth is hypothyroidism. TSH becomes high, commonly known as thyroid problem, is a common cause of fatty liver because most of the cases are associated with obesity. But even if it is not associated with obesity, can lead to fibrosis because of metabolic disturbances. These diseases, particularly diabetes, hypertension, cardiac disease, fatty liver, can happen together in some patients, and these are collectively called as metabolic syndrome. This is a very, very common cause and very important cause of fatty liver. There are many other medical conditions, medicines which can lead to fatty liver. So knowing that fatty liver is the most common diseases of liver around the world, and that it can be prevented and cured. Disciplined lifestyle, regular exercise, keeping your weight below threshold level, restricting your alcohol intake to social intake can keep you away from fatty liver and complications thereof. So this is not normal. If you have not noticed or not practiced these things in last few months or over these years, just try it as an example even. Follow these lifestyle modifications for 3 to 4 months and ensure this will bring the positive uplifting and motivation to your life and quality of your life, that it will be self-motivating to practice these methods to prevent fatty liver and its complications for your entire life. Another help that you will gain with these practices, that you will also keep yourself away, at least to a major extent, from hypertension, cardiac diseases. Even diabetes control becomes better. So follow these simple things. With practice, you can make them as your habits and keep your liver, heart, lungs, and all organs healthy. Thank you so much.